Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. So today I'm going to answer another question some of my patients and also a lot of you guys have asked, which is what is the cause or the reason behind pain on the outside of the knee? So I'm going to start with going over some of the structures on the outside of the knee that could be responsible for pain on the outside of the knee. So let's start with just getting used to a little bit of the anatomy. And if I bend the knee and look at the joint line, so on either side, so I'm going to search and find the joint line, which is essentially the meeting point between the femur, which is the top bone, and your tibia, which is this main bone, your shin through here, as well as here's your superior tibiofibular joint. So this is fibula, the other small bone that goes down through here. So joint line, and then think all the structures that are going to be sitting through this region. So you have your lateral collateral ligament sitting here, which is basically the outside support for that knee joint, one of the outside supports for that knee joint. Just like you have your medial collateral ligament or MCL on this side. So you have your LCL through there. You're going to have your lateral meniscus sitting there. You have a coronary ligament, which is holding the meniscus. And you have of course, your soft tissue structures through here too. So you have your IT band, which is the structure that quite often gets irritated in a lot of people. Runners, for example, will have a lot of these issues too with the IT band coming through here and attaching down here. So you can even have your, on the outside part of your kneecap, your lateral patella through here, structures that could be causing a problem too. So your quadriceps here, which is the top muscle, your quadriceps expansion, connective tissue, and other tissue coming through here along the outside border of the kneecap and inserting and going into your patellar tendon, which is the base of the bottom of your kneecap and coming down and attaching here. So you can have essentially problems on the outside border here too, whether the tissue is thickened, scarred down, adhesed, or irritated or inflamed. Any of those things can cause problems on the outside of the kneecap here. And then the outside of the patellar tendon can be problematic also, like patellar tendonitis, patellar tendinosis, or any other degenerative changes that might take place in this region. Your meniscus itself, if the meniscus is torn, there are degenerative changes, or the coronary ligament is irritated or adhesed or inflamed, can be causing problems through here too. Of course, your lateral collateral ligament could be scarred down, could be partially torn, could be completely torn at times. So less common than your medial collateral, but still that is one of the structures that could be causing the pain too. And of course, as I mentioned, your IT band that comes through here could be, quite often gets really irritated and inflamed through this area. I often see that after surgery also. And that gets, all these tissues through here get really tightened up and irritated. So that could be another reason why your people have pain coming down too. So you really have to look at all those structures that could be contributing to the pain. And then the joint itself. So arthritic changes in the joint can be causing pain through here too. So all this stuff has to be looked at in relation to your foot, what's happening in terms of mechanics at your foot. Is the foot not giving you adequate support? Is too much pronation, or you're flat-footed and that doesn't give the arch enough support, or excessive supination, or going the other direction, rigid foot or arch, high arch, which is also changes the mechanics up the chain, could be causing problems too. And also further up the chain, if the hip is too tight, right, or the mechanically there are changes in the hip, or the muscles, the glutes, for example, and other muscles are too weak, that will also impact what happens further down in the chain too. So you have to really look at what's happening above the joint and below the joint, in addition to at the joint. So the muscles, your quads, your hamstrings, your IT band, your adductors on the inside, your calf underneath. So all these things have to be looked at to properly address what's happening on the outside of the knee. Okay, So I hope that gives you an idea at least as to some of the structures that can be involved in this process. And I have a bunch of videos that I've done in the past that have looked at more specifically some of the cross-friction massage techniques and some strengthening exercises for these structures to address some of the knee-related issues. And I'll be putting up more stuff, more specific to specific conditions also, so you get a better idea. So if you have any questions, please leave a comment. Make sure you click on the link below to go to the website, and you can get lots more information on knee-related problems or other joint soft tissue injuries and rehab or recovery ideas. And make sure you subscribe to the channel, and I'll post some more stuff for you guys soon. Thanks.